potential for infections, particularly gram-negative infections, to spread in a way that we don't have any opportunities or any antibiotics that are effective for those types of infections. We have some good treatment options for Staph aureus infections that are resistant, so MRSA, which is the most common gram-positive resistant organism that we talk about frequently. But the other types of infections that I'm really worried about are the infections that are caused by the bacteria that tend to live in our gut, but can enter into, say, our urinary tract system, or potentially cause a bloodstream infection or an intra-abdominal infection. And we're seeing more and more of these types of gram-negative bacteria. An example is E. coli, that are highly resistant to multiple types of bacteria. So we're already in a situation where we have very few or sometimes no options for treatment. And if we continue on this path, we really may be in a situation where common infections, a urinary tract infection, a case of a patient who has an outpatient pneumonia, someone who injures their leg and gets an infection of their leg, that these infections that we once thought we could treat with an oral antibiotic would now either require hospitalization or we'd be in a situation where we couldn't treat it at all. So that's what really keeps me up at night, that we need to be thinking about, okay, well, what do we do in this scenario? And I think what we talked about earlier is really how we have to tackle this. This is not any individual's fault. We need to think about this as a collective problem that we can all come together to fight. And we also have to make sure that we engage all the different stakeholders that can play a role in addressing this problem.